This presentation aims to explain what it is like for an adult living in America to navigate the healthcare system without access to broadband internet. Internet and healthcare have become incredibly intertwined in the past few decades. So intertwined, in fact, that one of Healthy People 2030's goal is for broadband internet access to increase from 41.5% of adults to 60.8% of adults. Some things that are making healthcare and internet so intertwined include healthcare systems using internet in order for patients to access tests and appointments, and the increased utilization of telehealth that became extremely prevalent in the COVID-19 pandemic. People that are unable to use the internet are unable to for a multitude of reasons. These include the cost of internet, lack of internet connectivity, lack of a phone or a computer, and lack of money. Similarly to this, lack of internet can also lead to social isolation. This became especially prevalent and apparent during the COVID-19 pandemic with older adults. Unfortunately, whilst the pandemic was happening, this discovery was unable to be rectified, thus creating the Healthy People 2030's new goal. Others that were left isolated during this pandemic include people who did not have internet that were attending 12-step programs or other support programs that have moved to online. They stated that it became more difficult to stay on track with their goals when they were not able to hear the stories of others who they had begun to lean on for support. Others that are being held back by lack of internet are doing so because they have difficulty with hearing. Their difficulty with hearing is causing issues, especially during telehealth appointments. In a study done in South Carolina, 95% of participants that had poor hearing stated they had poor access to healthcare delays, and increased difficulty with communication. These delays could lead to far worse outcomes for those diagnosed with chronic conditions like asthma and diabetes, and could lead to fatal outcomes for those diagnosed with quickly progressing conditions like cancer. These frustrations led to some patients foregoing cares, further worsening their already problematic health issues. Others that cannot use internet are that way because of homelessness. Homelessness creates new challenge, like the inability to charge devices they may have, risks of being robbed, technical constraints, problems finding quiet and private areas to take doctor calls, and issues finding internet connection. These lead to issues like inability to make an appointment, since most places require a call or a form to be filled out, inability to see lab results, missed appointments without a way to follow up or reschedule, missed critical results, and increased stress for those who only have a phone to access internet but live in constant fear of it being stolen. Some living in homelessness confess that this constant fear of their phone being stolen has led to them sleeping with knives underneath their pillow, which has led to even more dangerous situations. Others have issues with internet due to medical conditions like strokes. Arguably, this new chronic condition requires more medical attention than the average American, but now these people are left to depend on others even more, since they are unable to navigate the new age of the internet themselves. Lack of easy accessible healthcare records can lead to gaps of care and farther delays in treatment, making this 2030 Healthy People goal more pertinent than ever.